Okay, good afternoon, everybody. My name is Chris Millington. I sit on the governing body of NHS Barnsley Clinical Commissioning Group as a lay member. I cover public and patient engagement. Today we're holding our primary care committee in public, and it's my responsibility today to chair this committee. It's important to note that we will and are in fact recording this meeting. This will enable the public of Barnsley to see what we do and how we discharge our responsibilities on their behalf. I will shortly introduce the committee to you and how they contribute to this important committee. A special welcome to Nick Germain, Primary Care Manager from NHS England, and Carrie Abbott, Service Director from our local authority.
Thank you.
So, bear in mind we're in public. I'd just like to set the scene very briefly. But within the health service, we have both primary and secondary care. Today, primary care is about doctors and your local general practice. And as commissioners, we buy or commission services on your behalf. We buy a whole range of treatments and consultations, and we buy those from our secondary care providers, generally local hospitals. Our agenda today will see us talking about our finances, ongoing issues within primary care, and we will also have a presentation from our head of governance regarding what is known as our risk register. Every business has risks and opportunities, and we assess those risks at each and every committee we operate under. I anticipate this meeting will take about an hour to complete. So, to the introductions of our committee members. I'll call out your name, and if you just like to wave, the general public will then be able to at least put names to faces. So, Nigel Bell. Nigel is chair of our audit committee. Mike Sims. Mike is our secondary clinical support service. Richard Walker. Richard is head of our governance. Dr. Gunter Muckler is a local GP who's waving at you now. Chris Edwards. Chris is our accountable officer.
Sorry, can't see my hand because of the background. I'm present, Chair.
Julie Frampton. Julie is head of our primary care. Nick Germain, I've already highlighted, his primary care manager, working with the NHS England and improvement. Ruth Sims, where are you, Ruth? There she is, waving away. Is one of our finance managers, important person. And Carrie Abbott, who is Service Director, Public Health. And I may, Carrie, at some point, maybe after agenda item 8, just to call you in just to give us an update on, and I do mean a brief update on what's happened today. So let's start the meeting proper. I have apologies from our chair, the CCG, Dr. Balash, and Sue Womack, who is the manager at the Health Watch in Barnsley. Angela, are we quorate? Yes, we are.
We are, Chair, yes.
Thank you. Okay, on to agenda item 3 then, which is declarations of interest in relation to this agenda. Can I ask, are there any changes to that declaration which we're already looking at? No. Madhuri?
Yeah.
No changes, Chair, but just to reiterate that being a GP, there are items with regards to contractual issues, etc., which will have implications. So I would like to be sort of not involved in them meetings.
Okay, I'd also like to confirm that we have received from Nick Germain his declaration of interest, and it's recorded as nil. So thank you for that, Nick. Now, I want to pause at this stage because within our agenda today, we have at agenda item 8, our contractual issue report from our head of primary care. And there are 2 items within this report that are asking for committee approval. At item 5.1, we have information concerning Barnsley Healthcare Federation. And I want the minutes to acknowledge that all our general practitioners on this committee have already declared an interest in the Barnsley Healthcare Federation. And as such, they all have a non-financial professional interest in this item. Our GPs are non-voting members of this committee, but they are a vital influence in relation to being clinical advisors to us all. Any decisions taken to approve any items today will be taken by the voting members, that's the executive and lay members. So as chair, I'm happy to allow our GP members to remain present for these items, to allow them to hear clinical aspects of this proposal, and if required by the voting members who may be asking for further help on the clinical advice. So on to item 4, which are the minutes of our last meeting. And please forgive me if I keep pointing my head one way because I'm working off 2 screens at the moment. So the minutes refer to the 24th of September. What I'm looking for is accuracy. Are these a true record? I'm happy to accept any minor amendments, and then we need to approve and adopt these. Nigel.
Yeah, thanks, Chris. A couple of points. On the first minute, it says the committee received and noted, etc., etc. On the second minute, it says the committee were asked to. Surely the minute should say what we actually did, not what we were asked to do. And then that drifts all the way through the minutes, so item 3, etc. So could I recommend that the minutes are changed to say what we actually did, not what we were asked to do?
I'm happy with that. Any dissenters on that correction? And
my second point is that the agreed action lay member for government suggested update on PCN staffing, etc. at 2011-08 is not on the action summary. So it's an agreed action, but it doesn't get to the action summary.
Right, okay.
So that needs adding to the action log, I would suggest.
Yeah, I would agree with that, Nigel. Thank you for bringing that to our attention. Any other concerns that need addressing? Okay. Are you taking your hand down, Nigel? Thank you. Can we adopt these minutes then, please? Yes, thank you. Okay, on to agenda item 5, which is matters arising. Just to clarify, at 200906, it was agreed to present to the primary care update to a future meeting with the patient council. I want to confirm that that meeting has taken place, did take place, and the patient council were very grateful of the update that was given in relation to our primary care network. So that can come off, I think, shortly. The GP patient survey, Julia Frampton is going to touch on that very briefly, and the best update we've got for that particular item. Any questions? Anything at all, Nigel?
Yeah, I'm glad you raised that one, Chris, and thank you, Julie, for the update that's on the papers, and happy to receive that in due course. But mind to recommend that we say that it was reported to the November meeting, which it was, but that it'll need coming back again once you can do the full analysis once the COVID restrictions have diminished. Because a lot of your report says, well, we would have done this, but we can't. So, which I'm happy with. I'm not criticising, but I just think we need to keep on the action report that it's going to have to come back again.
Yeah, Nigel, I quite agree, and I think when we have an opportunity to engage again in a fuller manner with our practices, we will do that, and we'll also note it through the quality reporting to make sure that it's mentioned and captured through our quality and patient safety group too.
Yeah, so if we just put that it will come back again.
Yeah.
On the action report, that'll be fine. Thank you, Julie.
Thank you. Right, on to item 7, which is our finance update. And Ruth, I think you're going to take this, yes?
Thank you, Chair. So I'll assume the report's been read. The report highlights the budget requirements for 2021 as set out in the first table. Just to note, the financial requirements are higher than the CCG's allocation for primary care co-commissioning, of which the pressure noted in the paper will be funded from the CCG programme allocation. The second table in the report highlights the primary care network contract DES requirements, which is highlighted in 7 areas, and also a note to add the £1.50, which is funded from the CCG core allocations. The bottom of the report, there's 2 extra points which highlight 2 sources of funding that the CCG will be receiving. So the first one is the GP forward view funding in line with 1920. Discussions are currently ongoing to the financial value for this that the CCG will be receiving, and an update will be provided at the next committee. And the next and the last point on the paper is with regards to the Supporting General Practice Fund, which is the 150 million which has just been distributed to ICSs, and it's similar to the GP forward view. There's current discussions ongoing, and the committee will be updated at the next one. Thank you.
Okay. Short and sweet, Ruth.
Definitely.
Any questions for Ruth? Any challenges for Ruth on this paper? No. Ruth, thank you very much indeed. Thank you.
Thank you.
Okay, on to item 8. Julie, we've got quite a long report here. And what I want to do is I want Julie to take us through it, because what is required is approvals. There's 2 approvals. It's here for assurance. So when Julie has got through this particular paper, I will then go back to the approvals and ask the voting members what they want to do, how they want to vote. So, Julie, over to you.
Okay, thank you, Chair. So the first item within the contract report is regarding the contract that is currently with Barnsley Healthcare Federation, and that's for the Brierley Medical Centre. They are on an APMS contract which is renewable every 5 years with a plus 1 year option. Due to the current COVID-19 pandemic and the amount of time and effort it would require to actually go out and do a procurement, it was decided that we would ask for the committee's approval to take up the option of the plus 1 year contract and prepare to do a procurement for that contract ahead of that additional year ending in March 2022.
Okay. Julie, just for the members of the public, we've got a bit of jargon there, the APMS. Would you very briefly like to outline what that means?
Yes, I'm really sorry, my mind's gone blank. So Nick, you might have to help me out because I can't remember exactly what it is. I know it's something. Is it alternative primary medical service contract? You're on mute. Sorry, Nick.
Sorry, alternative. Yeah.
Alternative.
It's personal medical services.
Okay.
Yeah.
Thank you.
Thanks, Chris. So,
can we just say it's right using jargon and it's giving the name, but what does it actually mean?
Yeah.
Nigel.
Sorry, I just had a question on this one. I'm quite happy to extend it, so I don't want anyone to think I'm not doing that. But if it was going to terminate on the 30th of November of this year, and today's the 26th, what would you do if we said no? And I suppose as a focus to that, I'd hate to think I was sat here on the 26th of November next year being asked to do anything.
So this is our only APMS contract that is of a 5-year +1 period. All of our other APMS contracts are 5 years plus 5 years plus 5 years. So with all the work that the team was doing around the COVID work and supporting that through the lockdown, we did miss the date was coming up to actually start to look at this in terms of procurement. So if you said no today, we would have to do some rapid procurement to make sure that we still had a provider. Yes, it was an error on behalf of my team and myself. We did miss that date. We would have a way to reconcile this should we have needed to. So if the committee's decision today is not to extend or take the option of the +1, we would have to do some rapid procurement. And we may need to use the emergency procurement framework to enact that.
That's fine, Julia. I suppose the point I'm making is next year I'd like to see this in September.
Yep.
In November.
Yeah.
Thank you, Nigel. You want to move on, Julie, now?
I think Richard might have a question, Chair.
Sorry, Richard, missed you there.
You're on mute, Richard.
How many months are we into this COVID, and I still do that at least 50% of the time. So sorry, my question is I think a fairly simple one, because there's an inference in the recommendation that you are confident, Julie, that you know there's nothing in the way that this practice has provided its service over the last 5 years that would give us cause not to extend it. But just so it's explicit, you know, are we happy that this is a practice that's delivering a good service to the standard that we would want them to as a CCG? Yes.
I should have made that clear. Thank you. Yes, we are quite happy with the delivery of the service, and you know that is one of the reasons why we would choose to accept, ask for the committee to approve the +1 on that contract.
Apologies to the committee in that Julie and I generally make a point of going through some of these points, and Nigel, I actually missed that. You're quite right, it's the 26th and that's the 30th. All I can say is that the team are working extremely hard under some very difficult circumstances. So we have a decision to make, and when we make that decision, that's when the next stage will take place. So, Julie, if you want to move on to Huddersfield Road Surgery.
Yeah, thank you. So Huddersfield Road Surgery has had well, quite happily have recruited a new GP partner to their contract. They hold a primary medical services contract with the CCG, and this is just for approval that this GP is okay to take up posts, well, be in post. Quite often there is a lag in timing between the request from the practice and for all the due diligence to take place through the various different organisations. So this request has been reviewed by NHS England and there is no concerns. So this is for us to say that we were happy as a primary care team, there were no concerns, and now the ask of the committee is to approve this new GP to this contract.
Okay, Nick, were you involved in that in any way, shape or form?
Not me personally, not me directly, but our team have carried out the checks. Yeah.
Okay. So yeah. you are happy and assured. Yeah, your team. Okay.
Yeah.
Okay. Keep going, Julie.
Okay. So Royston Group Practice have also secured a new partner who's taken up post in September. Again, this person will have been through the same checks and approvals. This is a GMS, General Medical Services contract. So this is for noting and information. The next section is 5.2 is rent reimbursement for general practitioner practice, GP practices. CCG remunerates practices in line with the requirements in the premises cost directions for rent reimbursement. Huddersfield Road have gone through a process for their review. This funding is already accounted for within the expenditure in the programme budgets, which Ruth and I discuss and make sure we capture as they come along. So this is just to note that that has taken place.
Okay.
So sorry.
Any questions for Julie on that? Oh, okay, move on, Julie.
Okay. So 5.3 is the general practice service delivery. I'll take it that you've read all of this and are aware of the contents. This is something that we alluded to earlier around some of the asks of primary care during this year, and that we haven't really followed up rigorously. It is something that we have taken note of and we will pick up. And it's really just to note that we have partially done this, and we will pick it up and continue into the hopefully back half of this current financial year and pick up again in the next financial year. GP survey analysis is a very similar thing. We've started to go through and look at all of the recommendations in there. Again, it's an ask of primary care in addition to what they're already trying to deal with. So this is something we have noted and we are pulling together in a plan that we will support practices with next year, probably, well, back end of this year into next year and the financial year. Practice e-declaration. Again, every year the practices need to declare their compliance. It takes a while for all of this information to come through. We are a bit delayed with doing some of the analysis in this, and that is partly due to the work that we picked up as part of the early pandemic. We have gone through all of the details. There are things that we have picked up and already checked with practices. There are other elements that we will continue to pick up. Some of this we need to do a comparison last year's 2019's to 2020's e-declaration, and this is something that helps inform our quality dashboard, which again we pick up through the quality and patient safety group. So this is just to note.
Julie, can I stop?
Sorry,
Nick,
of course you can.
Yeah, I'll just quickly come in. Thanks. It's a really comprehensive update. I think it shows the breadth of things that the team are working with. Just under the 5.3 GP practice service delivery, the sort of second to last paragraph, it says 4 practices have advised they're not currently offering telephone and online appointments.
Yeah.
One of the context of that, I know it's obviously key to how they would be operating under the COVID.
It is, and we understand that they misread the question. Okay. So they are compliant with their contracts, and we have picked this up because obviously this was something that we were immediately on top of. Yeah. And as you're quite right, in this current climate, this is quite the way of working for our GPs at the minute.
Thanks for that clarity. Great.
Before we move on, Julie, I want to ask the committee if there are any concerns over and above the points that have already been brought out. Has anyone got any questions for Julie on this particular item?
Focus on the context that I'd like this to be scheduled to come back again in February or March or whenever.
Yeah.
I know, Julie, you're going to do it, keep updating it, but I think given the number of areas that you're still working on, although this is some assurance, I would like to get further assurance. So if we could timetable it and you pick a month between now and the end of March, but if we could do that, that'd be great. Thank you.
Yeah, happy to do that.
Thank you, Nigel. Okay, welcome to Dr. Mark Smith, who's just joined us. Welcome, Mark.
I've been here all along.
Oh, why am I not just seeing your wonderful face, your wonderful smiley face?
I don't know. We've all got a cross to bear.
The pluses and minuses of IT as up today. I can't wait to get back to face, but I know I'm on a limb on that one at the moment. So, Julie, if you'd like to continue on the best update you can give us in relation to the GP survey, and like Nigel, we were both concerned when this first came to fruition that we really needed to get wound into it to not criticise but help and assist. It's fair to say that there were some pretty good results out of this. It wasn't a disaster, far from it. And when you look at some of the percentages achieved, they're great, but they can be better, and we all know that. So if there's anything to add to that, Julie, I'm more than happy to for the committee to listen to what you've got to say.
I think on the whole, yes, we are quite pleased with what we've got, but there is always room for improvement. And I think it is then just sort of really understanding where we can take this and how we can support practices, and then what the ask might be back from practices about how and what that support could look like. I think it's something that we have been starting to look at as a team in developing how we could do that. But unfortunately, with COVID, we've just sort of put that a little bit on the back burner and just try to support the practices with dealing with practice life as it is and as it continues to be and evolve as we move through all the various different stages of the COVID-19, really. But yeah, I take your point. There is work to be done, and it is something that we will look at and develop as best we can an action plan to deliver hopefully better results building on what we got.
Okay, any further questions for Julie on that? No? Okay, on to 5.5 then, Julie, e-declaration update, quite a bit there.
So the EDEC, as I mentioned just a minute ago, is something that happens every year in practices. This is 2019's, which has taken us quite some time to complete. So some of the things that we've already picked up, as I've alluded to in the GP survey, and some of the things that we will be picking up as we move on. In the same sort of way, we're going to work with the practices to build on the results, and also to check 2020's EDEC, because it's usually in sort of December time that the practices are required to submit their annual EDEC. So we'll have last year's and next year's to look at for comparison, and to again build that support in for those practices where we think they might need a little bit of additional support.
Okay. So for the members of the public, Julie, just if you just want to maybe headline read to take us through that paper. I noticed we're talking about staff details, premises and equipment, etc.
Yeah.
And if anything else you want to pull out to make sure that both the committee and members of the public are cited on what we need to be citing on. Okay.
Yeah. So I guess in terms of the couple of practices around their patient participation groups, we had started to do some work on that, but again, that will be picked up probably later on in this year and into next year. For that, again, it's probably not the most helpful thing to be trying to ask practices to do. Some people are really au fait and happy with the technology to do things over Zoom or for Microsoft Teams, but there are others that aren't. So I think it's just we're aware that we need to pick this up and move it on. There is some work going on to support practices around the various asks. So for instance, we check that the practice, that our dispensing practices are compliant, and we link in with meds management teams, so that there's that look. And Nick, that will be picked up more widely through the community pharmacy route as well, I believe, some of the pharmacy aspects.
Yeah.
Yeah, cool.
Yeah.
CQC, obviously at this moment in time, the CQC inspections aren't happening in the way that they were. We still continue to have informal conversations with the CQC, who are still having conversations with practices that were quite not in difficulties, but were under the umbrella of some of the support through the CQC. Gladly, most of our practices haven't needed intense scrutiny, and the CQC are still reporting to us that there are no concerns being raised with our practices through that lighter touch assessment. GPIT, sorry.
Julie, again, for the members of the public, when we talk about the CQC, what we're talking about is the Care Quality Commission.
Yeah.
Just very briefly explain what they do on behalf of our GP practices, Julie.
So the CQC are responsible for making sure that the practices are delivering safely and have safe practices, have safe protocols, have good processes in place to pick up any anomalies. Staff training is completed. Any safety issues are picked up, making sure that the staff are properly qualified, all those sorts of regulatory checks. They do more of the softer elements, just checking in and making sure that if there's a number of patient complaints, these are highlighted with the practices so that they can be assured that the best quality service is delivered. We tend to report quite a lot of this through our patient and quality safety group, but we do report here as well when there are any issues raised by the CQC. Thankfully, that's not many of our practices, and those that have been reassessed, and that's part of the CQCs, is to go back and regularly reassess practices that are deemed to be struggling.
Okay, and the CQC in their rating, green is good, and we have across Barnsley an absolute sea of green, haven't we? So without exception, we are delivering exceptionally good service, and the CQC have acknowledged that within all of our practices. So that again is good information for our general public. Okay, do you want to move on then?
Sure.
Any questions for Julie there? No? Okay. Julie, if you want to move on to the practice development agreement then.
Yep. So the practice development agreement is an agreement that all our practices sign up to deliver specific schemes each financial year. This year has been quite different, given that as we were finalising and beginning to think about rolling out the PDA to the practices for this year, the pandemic hit us all, and we had to rethink about how we do these things. Most of the Q1 and Q2 all of the Q1 and Q2 payments were made to the practices without there being actual schemes to deliver against, and this was because it was unreasonable to ask practices to do an awful lot of additional work when they weren't working in a normal sort of practice way, and that the absolute priority had to be making sure the patients were seen and kept safe, and staff were safe as well. The medicines schemes within the PDA have gone ahead, and our practices are engaged in delivering that, and there are discussions ongoing about the PDA for the rest of this year, and also some discussions about how we approach developing the PDA for next year.
Okay, any questions? Okay. The final one, Julie, you're just going to confirm Caxton House for us, I think.
Yep, just to inform the committee that the Caxton House surgery closed as planned on the 31st of August. All of the patients were allocated to new practices where they hadn't already asked to register at practices of their choice. And we did take the decision to allocate some patients to make sure that there wasn't any loss of care provision for those patients. All of the work to finally close down the practice is continuing under the GMS contract. The contractor has three months in which to complete all their financial obligations, and we are almost complete, and we have almost completed that process. But just to say that we were really quite clear that all the patients were cared for appropriately and moved across to new practices safely.
Okay, Julie, thank you for that. And the rest of the committee may not know or actually realise just how much work you and your team put into this, because it really has got to be a very clear and concise dot-to-dot exercise, and I'm sure Nick would agree with us on that. First and foremost, to safeguard the facility, to safeguard the patients within that facility, and indeed to safeguard the incumbent GP. So I've kept very close to this one for sure, and I'm happy that Julie and her team have really pulled this off in a very short space of time. But nevertheless, all of the dots were dotted and all the T's were crossed. So again, thank you, Julie.
Yeah, I agree from NHS England perspective as well. We're assured it's all been done really effectively. So, and some of the due diligence has financial due diligence has captured some of the back-ins and things under NHS England, so that's been covered as well with the process.
Thank you, Nick.
Thank you.
Now, what I'm going to do really is I want to address the voting members of the committee, and I'll come to you first, Chris. Can I ask, do you have sufficient information to allow you to vote and approve, if necessary, the APMS contract variation at Brierley.
Yes, Chair.
And your outcome is what?
Yeah, I support the recommendation, Chair.
Okay. Nigel, do you have sufficient information to allow you to vote on this item?
Yeah, I support it as well.
Okay. Mike Sims, are you?
Yeah, I'm quite happy, yes, thanks.
You're going to vote for this? Yes.
Yeah.
Okay. Richard, do you have sufficient information to allow you to vote on this particular issue?
Yes, but happy to support Chris. Just from a governance point of view, for the clarity of the minutes, unless there's any dissent amongst the group, I wouldn't record it as a vote. Particularly, we tend to vote by consensus unless there's we tend to take decisions by consensus and would only go to a vote if there was difficulty in achieving a consensus. So I think we can just record this as, you know, voting members expressing their support for the recommendation.
Okay, and as chair, I'm happy to approve this proposal. So again, coming back to the second approval that we're looking for is the addition of a new partner at Huddersfield Road Surgery from the 1st of August. Any dissenters on that? So we're happy to approve that. So if the minutes could show that both the APMS contract at Brierley was accepted and the addition of a new partner at Huddersfield Road was also accepted with 100% approval. Julie, if you could now just take us through the remainder of the ask and then we'll complete that particular paper.
So the ask of the Primary Care Committee is to note the addition of Dr. Krug as a new partner at Royston Group Practice, to note the rent reimbursement for Huddersfield Road Surgery, to note the work completed in excuse me, in respect of the GP practice service delivery, and also note the GP survey analysis results, to note the update regarding the 2021 PDA, and to note the closure of Caxton House Surgery.
Okay, thank you for that. I think we're all content on that, and thank you for the paper, Julie. If I may, before I move on to item 9, Carrie, would you like to give us a few minutes as to where we are in relation to Barnsley and the work that you're doing?
Yes, thank you, Chair. I guess it's topical just to update everyone. I'm sure people might have seen on the news already that following the end of lockdown next week, Wednesday the 2nd of December, Barnsley, along with the rest of South Yorkshire, will be in Tier 3. That's the very high restrictions tier. The full details, everybody can find that on the government website. There are some really helpful infographics and posters there. I guess it's perhaps important to note that although we return to Tier 3, there are some additional restrictions for us this time. So things like pubs and restaurants are only allowed to offer takeaways or drive-through or delivery services, and we can meet as in the rule of 6, as they're calling it, but only in outdoor public places, so a public park, for example, and not indoors and not even in private gardens. So I think we all need to be mindful of that. Good news that support bubbles will be extended, and thinking about bubbles, I'm sure people will have heard something about the Christmas bubbles that the Prime Minister announced this week. So from the 23rd to the 27th of December, 3 households will be allowed to form a temporary Christmas bubble, mixing indoors and staying overnight. I think it's really important to stress that those bubbles will be fixed. So we must ask people not to mix with 2 households on Christmas Day and then a different 2 households on Boxing Day, etc. It's also perhaps important just to note about how we might move out of tier 3, and there will be a review every 14 days. We're being told at this moment in time that this regional approach will last until March. There are 5 key criteria that will be used to help us hopefully move out of the tier that we're in. So they'll be looking at case numbers across all of our age groups. We'll be looking at specifically about cases in the over 60 age group. We'll be looking at the rate of rise or fall in infections, the percentage of those people who get tested that have the virus, and then current and projected pressures on our NHS locally. So they take into account all of those things when they decide which tier to put us in. Obviously, lots of work, as Julie and other colleagues have touched on throughout this meeting already, both within health and social care across the council and our partners around efforts, and I'm sure we would just want to say a big thank you to everybody, whether that be local people in Barnsley or staff and or staff working in Barnsley, for the huge efforts that are being made to keep infection rates down, and just a plea for us to keep on going to continue to drive our rates down, because whilst they have been coming down over the last week or so, they do remain high and significantly higher than other parts of the country. Thank you, Chair.
Thank you, Carrie, for that. Any detailed questions back to Carrie on that scenario? No, thank you. All right, Carrie, thank you for that. Richard, on to item 9 then, please.
Yeah, thank you, Chris. So this is the usual risk and governance report. Apologies from me. There's a couple of appendices to the report that I don't actually reference in the covering paper, so I'll try to pick up those verbally. But there's essentially 4 things that I was wanting to cover. There's the assurance framework, the risk register, and then the committee terms of reference, and also the committee work plan, which were included as appendices to the report. So as far as the assurance framework is concerned, I think I've mentioned at previous committee meetings that we over the last few weeks have been in a process of updating the governing body assurance framework, which was put in abeyance to some extent through the sort of height of the first COVID peak. That now has been refreshed and updated and signed off by governing body when governing body met a few weeks ago. So what you've got in front of you now is the updated and refreshed assurance framework. The bits of it that this committee will get to see on a regular basis are the sections to do with primary care, you know, self-evidently, and also the section on digital and IT, because there's quite a lot of GP IT related stuff that's picked up through there. So the assurance framework is there for your assurance, but also obviously any comments or thoughts that people might have on that. The risk register then is included in there as well. So and what you've got in your packs this time is the 1 red and the 1 amber risk allocated to this committee. In respect of both, there's been no change in the scoring around those risks since the last time. So again, they are there for the committee's information, and also for any comment that anybody may have if they think that there's anything that they would disagree with around the scoring, or if they think that there's any risks that we haven't currently got reflected in our risk register that we need to. As far as the terms of reference are concerned, and as I say, apologies that I didn't pick this up through the actual covering paper that came out with the pack. All of our committees review their terms of reference on an annual basis. This is about the time of year when we usually look at the primary care commissioning committee terms of reference. I have had a look through them myself, and from my point of view, there was nothing that looks like it needed changing. We've done quite a bit of work on them over the last year or so, tweaking the membership and the arrangements for the vice chair and so on. So it felt to me like they continue to be fit for purpose. But again, if anybody in reading their papers has spotted anything that they would want to change at this point, do shout up and we can take that forward. And then finally, just for committee's information, that we have included the committee work plan, which just again is there to reassure members and others that the work that we need to do as a committee is planned out across the year, so that hopefully we'll pick up all the things that we need to pick up. Again, that's mainly there for assurance, but if anybody thinks that there's anything omitted from that or in the wrong slot or whatever that needs to change, again, I'd be happy to hear that, really. So that's all I wanted to say, Chris. Thank you.
Okay. Any questions for Richard in relation to the risk register? Are we content that the current risks are scored correctly? Taking that as a yes. I'm sure you've been through terms of reference, and I agree with you. I'll come back to you, Nigel. I agree that you're quite right. We've done bits and pieces of work over the year, and we tweaked it, and I think that's pretty much as it needs to be. Nigel.
Actually, Julie put her hand up first, but I'll carry on. Just on the PCN risk, or sort of the staffing risk, which is red, and that relates in part to the PCN additional roles. And this is the action that was missing off the action plan to come back and inform us how we've got on. I think it would be useful to have that feedback in January, even if it doesn't give us the total answer, so that we can see it's going in the right direction, given it is our only red risk.
Yeah,
make that amendment to the action plan. Sorry, Richard.
Yeah, just thanks for that, Nigel. I agree with you, and I'll pick that up and make sure that we do feed it back in January. That's fine.
Okay, thank you.
Julie.
Yeah, just a couple of bits. Thanks, Nigel. I was going to pick up the same thing. Richard, I think in the October 2020, I probably have already put in some of that.
Right.
But I'm happy to bring it back in January, because we'll probably have a different position in January because recruitment is ongoing. And the other bit was in terms of the terms of reference, if I'm okay just to move on to that for a minute. I think we just would need to review some of the subgroups of the committee. That there have been some changes, and I think we would just need to clarify what those are, so that the committee is aware of how that is slightly altered, and also just to be clear what the remit of some of these of the primary care patient safety group, and also the primary care forum, which is now sort of replacing the primary care delivery work stream.
Yeah, thanks for that, Julie. That's a good point, actually, that we've done a bit of work around some of those subgroups, haven't we? So maybe we can I'll take an action to work with Julie, just to have a look at the terms of reference in the context of that, and if we feel that there's something that needs to change, I'll bring that back in January as well. It will be January, won't it? That's the next time we meet, if that's okay with committee.
Okay, Chris. Have you any concerns in relation to terms of reference there? Okay. Right. So we've covered the risk register, we've covered terms of reference, and Roxana would normally come in here on our work plan. So Richard, I think you may have got away with this one, and I must accept it. It must be absolutely right.
It's spot on, absolutely spot on. You can take it from me, Chris.
Thank you for that. Thank you for that. Okay, so on to item 10 then, conduct of the meeting. First and foremost, thank you for everybody attending, and I must apologise yet again to Dr. Smith. Mark, I did not see you come onto the meeting, so I apologise most profusely. I really am sorry. Any additional areas of assurance that anyone is looking forward to? Okay, and any training needs identified? Dare I say my training plan is 100% up to date? I said. Okay, item 12. I'm happy to listen and happy to act on items that we need to escalate to governing body. Nigel, anything? Come on, get us started.
I don't know. My only thought was that the COVID impact of the primary care teams monitoring stroke development of primary care. I don't know if that's worth putting on or not. Maybe Chris, you might have a view of whether that's worthwhile for the governing body.
I'm not sure what you normally take by exception. Probably wouldn't take that in my personal judgment, but obviously anything for information wouldn't do any harm. I suppose what we were looking for the governing body, so they're cited on it, or would you be looking for for information maybe? Just
to be aware, really, not.
So it would do no harm, would it, to take it for information?
Just be careful how we word it, I guess, but because primary care team are working very hard, I recognise that, but they are limited because of COVID, so it's just getting that balance, isn't it?
Okay, so that brings us to the end of this meeting. Our next meeting will be on the 28th of January 2021 at the same time. Richard, you've got a final word?
It was just, I think we may have skipped past the item on questions from the public.
Yeah, sorry,
that's all right, and it's just to record for the minutes that so we give members of the public the opportunity to submit questions by email, but we've had no questions submitted for this meeting.
Sorry, I'm guilty on that one because I'd already asked if there are any, and I'd off the top of my head. So thank you for that. So to officially close the meeting, I need that representatives of the press and other members of the public be excluded from the remainder of this meeting due to the confidential nature of the business to be transacted, which may be prejudicial to the public interest, which is section 1, brackets 2, Public Bodies Admissions to Meetings Act, and I have to say that. So thank you everybody for coming, and Richard, if you want to stop the recording, normally we would click